I've always been real active, so when I was first diagnosed with glaucoma, I didn't know what to expect.
From where I stand, I don't want to miss anything. There's a lot I want to see.
It hasn't slowed me down one bit. I work in a field where precision counts and others depend on me.
All my life, I've been playing the sports I love. I work at it every day, and it's no different for glaucoma.
Sunsets, seasides, silver linings. There's nothing more important than preserving your sight. And working in partnership with your doctor to manage your glaucoma is your best insurance policy. Because there's still so much to see. Knowledge is power in the management of glaucoma, and when you understand the disease and maintain a consistent daily regimen, you and your doctor can work together to help maintain your precious sight.
You could say I'm fortunate. My doctor caught it early. I was in for an annual eye exam and thought I could use a new pair of reading glasses.
We didn't even know that Ray had glaucoma. I didn't notice any difference, and he never complained of losing any peripheral vision.
My favorite conversations involve great moments in professional sports. For me, it's always been easy to talk about the things I love. But when I was diagnosed with glaucoma, I didn't want to talk to anyone. But that wasn't a winning strategy for me. Talking to other people has helped me gain a lot of useful information to give me back my confidence and keep me at the top of my game.
I had several relatives with glaucoma, so I pretty much knew what to expect. And it helped that they caught it very early for me. The type of glaucoma I have is called open-angle glaucoma, which is really the most common. I had no symptoms at all, which is why it's called the sneak thief of sight.
Glaucoma is an eye disease with a number of different causes, which in most cases produces increased pressure within the eye. In an eye that has glaucoma, more fluid is produced than can be removed by the eye. With nowhere else to go, this fluid builds up in the eye, causing an increase in pressure. Over time, this increase in pressure transfers to the rest of the eye. The optic nerve, the weakest area of the eye, is most vulnerable to damage from this elevated pressure. Continuous elevated pressure, or spikes in pressure, can damage the optic nerve and may result in vision loss, and can also lead to blindness if left untreated.
When the doctor said things weren't quite right and he wanted to check further, I just kept thinking, what is glaucoma? I didn't even know.
It turns out no one really knows what causes glaucoma, but they do know that pressure in the eye is one of the risk factors. So for me, it was simple. I knew I needed to keep up with my medicine on a daily basis to reduce the chance of gradual vision loss or blindness.
That's easy to say, but I could see the importance of building this into our routine. Like when we pack for a trip, I make sure we bring all of his medications with us.
And there's still a lot I want to see. And with a little help, I plan on it.
Not only did I not know what glaucoma was when I was first diagnosed, but I didn't know the risk factors. Turns out being Hispanic and having diabetes puts me in a higher risk group. But when I was diagnosed, I just sort of knew I'd need to apply the things I learned being a diabetic. I need to be disciplined with my medicine and keep regular visits with my doctor.
Early detection, followed by treatment, is the key to managing your glaucoma. You can do your part by making a strong personal commitment to regular eye examinations and to using your medication each day as prescribed by your doctor.
From my perspective, since glaucoma is the leading cause of preventable blindness, I'm going to do all the things I've been instructed to do by my doctor. He's emphasized the need to keep my intraocular eye pressure under control by using my medication consistently and scheduling my eye appointments regularly.
Treatment options for glaucoma can include eye drops, pills, laser surgery, filtration surgery, or a combination of these approaches. Some treatments can have side effects, so it's important to communicate with your doctor to ensure that you understand what side effects you can expect.
One thing that's important is to keep your doctor informed about how you feel on your medication. When I was first prescribed drops, after using them for many months, my eyes felt irritated. My doctor suspected the irritation might be coming from the drops themselves or the preservative in those drops called benzalkonium chloride. He suggested I try drops that did not contain benzalkonium chloride, and I tolerated them well. So you can see it's important to talk with your doctor so they can recommend a treatment program that works for you each and every day.
Taking action can preserve your vision. It will mean some lifestyle changes, but they should be modest changes. Make regular appointments with your doctor and take your medication on time every time.
For me, the lifestyle changes weren't that big of a deal. I just created a system for helping me to remember when to take my medication. For example, if your medication requires dosing 3 times a day, you may want to dose at meal times. And if dosing 2 times a day, consider taking your drops before or after brushing your teeth. If you dose once a day in the evenings, take your drops right before you go to bed.
Before each use, wash your hands, shake the bottle, remove the screw cap, and place it in a clean, dry area. First, hold the bottle upside down between your thumb and middle finger. This allows the product to flow directly into the dropper. Second, gently tilt your head back and position the bottle above the eye to be dosed. Do not touch the eye with the dropper tip. Third, place a finger under your eye and gently pull down until a pocket is made between your eye and lower lid. Fourth, gently squeeze the sides of the bottle to dispense 1 drop of medication. And fifth, keep your head tilted backward and close your eye for 1 to 2 minutes to allow absorption of the medication into the eye. Having glaucoma does not mean the end of your normal life. Advances in therapy and the treatments available today can help you maintain your vision if you're diligent and follow the daily regimen your doctor prescribes. Important activities include taking your medication on time as prescribed, seeing your doctor regularly for follow-up appointments, proper exercise, and eating well.
Medical studies show that taking 20-minute walks 4 times a week may be beneficial. Turns out exercise may actually improve blood flow to the optic nerve.
And there's no one food or diet that affects glaucoma, but eating a well-balanced diet and not smoking will keep you at your best. Be sure to tell your doctor if you're considering taking a multivitamin as well.
Sports medicine has seen dramatic advances in recent years. It's the same in eye care. Maintaining a healthy lifestyle and consistent treatment regimen can help you maintain your vision. I'm using the discipline I've learned as an athlete to help me maintain my eye health care. There's still so much to see.
It's estimated that more than 2.2 million Americans over the age of 40 have glaucoma, which can damage your vision before you even suspect something is wrong. That's why it's so important to keep ahead of the disease with regular eye exams and early diagnosis.
By partnering with your doctor and committing to a treatment plan, you can preserve your vision. This includes modest lifestyle changes and taking your medications on time every time. You can live well with glaucoma because there's still so much to see.